Hey guys, it's Dr. Nagel, and we're talking about tissue regenerative technology for treatment of degenerative joints. So, as you know from my previous Facebook Lives, I've had a degenerative knee. I tore my ACL when I was really young, and then from that injury, I've had degeneration. So, I've had stem cells, exosomes, PRP, all that regenerative approach. I've paid for that, thousands of dollars, $5,000 actually, to get my knee to heal and move toward, the function that it was years ago. So, I believe in that. I was exposed to this tissue regenerative technology, and it actually does some similar stuff. So what it does is it breaks open it opens up really fast the cell membranes, and I'm all about the cell. So it opens up that cell membrane and it releases these exosomes, and these exosomes are really important communication factors. And so they go and talk to the stem cells that are sleeping. So you have these mesenchymal stem cells just stuck in the bone marrow, and they're just hanging out. And so these exosomes go in and say, hey, come back to this joint and fix this cartilage, or fix, this ligament, or whatever the case might be. And then it creates healing. So this can actually cause that to happen, and it does cause that to happen. It's the only machine externally that I'm aware of that can actually stimulate that stem cell effect called the paracrine effect. The other thing that it does is it increases vascularity, so it actually brings blood flow to the joint. And at this point, I said this in the previous post, the Cubs have one for injuries for their professional athletes. White Sox have one, and I have one. And I had two treatments of this, and it's a really big investment. It's a really expensive machine, but it didn't matter to me because I've been out so many people are good joints, and neuropathy, diabetes, or thyroid problems, and this can help. So it was a no-brainer for me. This is truly nationwide, known for a long time. Neighbors in the lake, and I actually sent her down to get. She invested to get stem cells in her knee, and had pretty good results with that. But yeah, so she's pretty happy with that. Now it's time. It's been a couple of years. Time for a booster shot. I should get back to me over to normal. And so we did our experimental, not experimental, that's the wrong word. It's a diagnostic treatment. So for $49, you can come in and I'll figure out where the pain spots are. And then after that, you can decide whether, so you get an idea of what it feels like and what the treatment's all about. And then you can invest in actually a treatment program to, treat the knee. And so she had one true treatment. And what was your pain reduction?
I'd say about 50%.
So 50% reduction, which is huge. So this has two effects. One, it's anti-inflammatory. In the beginning, it actually blows up the inflammation, and you can hear it. And then the other one is it's long-term, big picture healing. It stimulates that healing process over 6 to 12 weeks. So awesome machine. If you know somebody who has a degenerative joint or one of those shoulders, like on the last one, they just can't get better conservatively. It's hanging out for 6 months or a year and they can't get it better. This is the guy. It can actually, studies show, knock out calcium out of that tendon. So calcific tendonitis when you get the grinding. So anyway, this is what the treatment's going to be like. So this is a pain spot, we know.
Yeah.
What's your pain level like?
6 or 7.
So starting at a 6 or a 7, we want to get that down to about a 3 or below. If it's below that, we're really not doing any good. So that's what it's like when we go to all those injured spots. And so it's going to blow out the inflammation and stimulate stem cells to come right to that injured spot. So, that's your review of the TRT.